Good afternoon, everyone, and welcome to today's webinar, sponsored by Workday, ranked best in class in the ERP category for healthcare technology. I am Brian Zimmerman, the Custom Content Editor at Becker's Healthcare. I'll be introducing today's webinar topic and our four terrific panelists for a discussion on choosing a healthcare ERP system for the future. I'll begin today's webinar with a brief overview of industry trends in healthcare provider organizations, focusing on how provider leaders are responding and adapting to change. Then we'll hear from our executive guests who will share a bit about their experiences choosing an ERP system at their organization. Joining me are Bill Moyer, Executive Director, Supply Chain Management, Advocate Aurora Health, Chris Pass, Chief Financial Officer, John Muir Health, John Hayden, Senior Vice President and Chief Human Resources Officer, Bronson Health, and Wynn Fisher, National Healthcare Advisor at Workday. Following the overview of trends, the panelists will introduce themselves, then Mr. Fisher will speak as we kick off our panel discussion. After we move through our prepared questions, we'll have time at the end of the session for an audience question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. About a week following the webinar, you will receive a copy of the presentation to the email you used to register. At this time, it's my pleasure to get us started by going over some industry trends affecting ERP selection. First up is cost reduction. Healthcare providers are under pressure to reduce operating costs, and supply chain, finance, and HR all present ample cost-saving opportunities. Opportunities for improvement in each of these areas continue to persist. Additionally, providers are being asked to do more with less. Department headcount budgets are not increasing despite increased workloads. This expectation to do more with less is persistent across the board from clinical to operational areas. Healthcare leaders are being asked to come up with creative ways to get their clinical resources refocused on patient care and not data entry. This is difficult, as often the back office has been underinvested in and processes are often manual or broken, leaving little room to take administrative burden away from the clinical teams with their current technology stack. Consolidation is the next trend. Consolidation remains one of healthcare's most predominant trends. Consolidation among large health systems involve everything from technology standardization to target operating model redesigns. For example, a large, recently merged system may partner more closely with a med-surg distributor to support a JIT distribution model that in the past may have not had a high enough service level. The provider is now large enough to command and influence a higher service level. Additionally, that same health system may look at consolidating all of their recruiting, onboarding, benefits administration, and other human capital activities into a shared services center to ensure the entire organization has the same people experience. These opportunities to scale can help reduce cost and variability in the operations of these now larger health systems, but they do not come without risk. They do not come with risk, As employee engagement functions potentially move off-site, providers risk a lower internal level of customer satisfaction and potentially engage. Additionally, all of this growth and the speed at which it is executed inserts complexity and risk into what have traditionally been risk-averse supply chains. As the focus on the supply chain will continue to be on balancing patient care and cost, providers will need to understand how to mitigate the risk of a larger, more complex supply chain while continuing to provide high levels of quality patient care. Our next trend is data-driven decision-making using AI and ML enabled by the ERP system. Additionally, data analytics and technology play an increasingly important role in supply chain strategy. Supply chain leaders rated improving data-driven decision-making as the most critical need in supply chain moving forward, according to a 2018 Global Healthcare Exchange survey. Roughly 60% of respondents said data and analytics were the highest priority areas for improvement in the next year. Healthcare leaders are being asked to help predict employee turnover, financial performance, and supply shortages in real time. It is no longer acceptable to present these metrics weekly, monthly, or annually. To remain competitive in the market, leaders need this information in real time in order to make the right decisions for their operations. Thus, they are finding with a higher and higher frequency that the technology they select and ultimately use will have a large impact on their ability to deliver these analytics at the pace desired by the organization. To sum things up, here are four main takeaways. Hospital leaders are struggling to support larger and larger health systems. Hospitals' greatest priorities include better understanding of costs and driving out operational and labor inefficiencies. Hospital leaders are being asked to deliver more insights faster in order to make sure they are making the right decisions for the future of their business. And finally, a common theme across all of healthcare is leaders are finding that the back office technology they are using to support the change necessary to adapt these trends are ineffective. They are turning to ERP technology of the future in order to transform their business operations and set them on a path to success for several decades to come. The long-term nature of these decisions tends to lead to a significant amount of focus and investment in the ERP selection process. And today we are lucky enough to hear from three healthcare leaders who have gone through an ERP selection process. So with all these trends in mind, I'm now going to ask our panelists to introduce themselves and share a bit about their organization and experiences on the ground and discuss some of the changes they're making at their organizations. We'll start with Mr. Moore. Can you give us an overview of yourself, your organization, and what current projects or activities you're working on at Advocate Aurora Health?
Yeah, Brian, first off, thank you for having me. As Brian mentioned, I'm Bill Moyer. I'm the Executive Director of Supply Chain Operations at Advocate Aurora Health. I have responsibility for systems, distribution, field operations, and purchasing. A little bit about my background. Started off my career, been into healthcare supply chain my entire career. Started off at Trinity Health. We did a ton of work around ERP selection, implementation across that IDN. Made a shift to Ascension Health after that. Spent a lot of time implementing PeopleSoft and doing a lot of business transformation with the resource group at Ascension Health. And then the past 5 years, I've been in Advocate Aurora, and a new executive director for the merged organization. A little bit about the organization in the background. So Advocate and Aurora merged in April of 2018 to form one of the top 10 not-for-profit healthcare systems in size. So just to give a flavor for everyone on the call, 70,000 team members. Recently just acquired a new hospital, so now 28 hospitals, $22 billion in community benefit, over 500 plus outpatient, non-acute facilities, and then over 22,000 nurses and 3,500 physicians. So very large organization. The thing I think from a supply chain perspective that excites us is if you look on the slide, the upper right-hand corner, the dense geography we have on that Illinois-Wisconsin border, with most of our geography concentrated on the eastern side of both states. So from a supply chain perspective, a lot of opportunity there that we're excited about. A few things at supply chain, really to sum up what Advocate Aurora Supply Chain is doing, it's rapid business transformation. Since our merger, we've taken on quite a few things. We just aligned our GPO, so we now are a premier GPO shop as of this past April. We are working through implementing EHR or Epic across the organization. We've had that fully deployed in Wisconsin, so we're in the midst of deployment in Illinois. And then the other thing we're working on is standardizing our operations. So our supply chain team has gone through it and developed what we're calling our supply chain playbook. I'll talk a little bit about that in the future, but a couple of key tenets of our playbook is really ensuring that we run the business appropriately for our size and scale. Some key tenets of that is staffing realignment, making sure the staff that manages supply chain reports to supply chain. We want to make sure we align authority with accountability there to really enhance our supply chain. Another component of our operations playbook is going to be inventory. So we'll be rolling out 2-bin Kanban throughout the organization that's already been implemented in Illinois. We are working on rolling that out throughout Wisconsin. The second tenet of our inventory is what we're calling our procedure-based inventory management approach. That's for the OR space, cath lab space, IR space. Our technique there is going to be integrating our EHR and ERP to drive decrementing, but also to enhance some of our analytics around cost per case, and really leveraging some of the advanced functionalities with G10 scanning. Another initiative we'll be working through is what we're calling our procure-to-pay initiative. That initiative really focuses on what are the controls, practices, policies around how we procure and pay for goods and services throughout the organization to make sure people are doing the right thing. I would argue that's one of the first steps in the chain before even anything like inventory management even comes into the fold. So we want to get a lot of control around that process. And then our distribution strategy. Phase 1 of the distribution strategy will be aligning our courier and freight approach And then phase 2, we'll be looking at a fully integrated distribution strategy in the acute, non-acute, and at-home space. So trying to bite off a lot here, but with our integration just a little bit over a year ago, we're really trying to align those business practices. A couple other things we're working on is standardizing our supply accountability approach. Really that revolves around some of our scorecarding and dashboarding analytics, and then how do we take those analytics and engage our clinicians, our operations leaders to really drive value for the organization. So we've spent a lot of time there. And then last and certainly not least, that's in the midst of recruiting a whole lot many new leaders for our organization, particularly in supply chain, and creating and focusing on how do we build our new culture, because we're still only a year into the integration. So we are continuously trying to improve that and be mindful of how everything we do impacts our culture, both from supply chain and the broader organization. So just a few things we're working on, a lot of fun stuff.
Thanks for sharing. I look forward to hearing more during the panel. Mr. Pass, can you give us an overview of your organization, what you've been up to, and what current projects or activities are you working on at John Muir Health?
Sure, and thank you, Brian, for having us on the panel. So John Muir has an interesting history and I think a very bright future as we think about being a health system in the East Bay of the San Francisco Bay Area. So we're challenged in being surrounded by some of the largest competitors in the country, but stand our own with 2 acute care hospitals, various joint ventures and partnerships, over 1,000 affiliated doctors, and then about 6,300 employees. And probably the most recent thing I've been doing, which got a bit of press last week, is we've just announced a strategic relationship with Optum around creating an option for independent community hospitals to remain independent. And so really trying to focus on driving costs out of our health system, looking at our support services in a new and unique way, and really trying to delight both our customers as well as our employees. One of the things that we did back in 2014 was we did go wall-to-wall Epic, similar to Aurora and then now Advocate doing, and really determined that we needed to have an ERP system at that same level because people loved working in the system around Epic on the clinical side, but we didn't have the same type of back office advancement. And so did do a selection, did end up choosing Workday and then running Workday through the health system with various go-lives, both originally back early on and then in 2018 and 2019. So for us, we continue to press ahead with improving clinical care and quality care, but I think in the back office and thinking about finance and administrative services, you're starting to see a consolidation for us to try to access scale that we otherwise couldn't have done. So we continue to look at new systems, but it really landed on the principle of if we can do it in our core systems, Workday and Epic, then we're going to do it in those systems, and we're not going to go out and look at best of breed because we find that to be very, very expensive to maintain long term. And so we've taken supply chain live most recently, and so the procure to pay, the really standardizing the purchasing, adding the controls around the financials, all of that efficiency has been happening over the last 18 months, and it's a lot of work, as Bill mentioned before, but I can tell you it pays off in spades, and we're starting to see an access to information much quicker to ramp up our decision times, which is increasingly valuable to us. We've been able to see reductions in the number of people doing the work, and also improved output, both for the folks using the system, if you think about accounting, but also for the end users receiving the information are delighted as well.
Thank you so much. Sounds like you've been busy. Mr. Hayden, can you give us an overview of your organization, some organizational focus areas, and what current projects or activities you're working on at Bronson Health?
Sure. Thank you, Brian, and good afternoon, everyone. As mentioned, I'm John Hayden. I'm the Senior Vice President and Chief HR Officer at Bronson Healthcare. I've been in the business for a while. Prior to coming to Bronson about 13 years ago, I spent about 30 years at Henry Ford Health System in Detroit, so I've been in healthcare my entire career. Bronson is, based on the slide there, you can see the Mitten State, which Michigan is, and our service area is in the southwest corner, those 9 counties. We've been around for over 100 years. We're locally owned and governed. We have 9,000 employees, which for us is we're the largest employer in the region. We have 1,400 medical staff members. And then we're connected through Epic as well, as previously pointed out. We're an Epic shop. We've doubled in size over the last decade, primarily through acquisition, so the implementation and the go-lives of Epic have been very important, which kind of led us to the overall Workday. We kind of refer, in HR, we refer to Workday as our Epic installation and implementations. We were on the PeopleSoft platform for probably 15 to 18 years, and it seemed when I got here every 12 to 18 months we were doing an upgrade, which was pretty labor intensive. So we decided through our strategic planning process that we needed to go a different direction. So we looked at Oracle, we looked at SuccessFactors, and then we selected Workday overall. And it's primarily the human capital management system to include payroll. When we look at some of the projects, our area of focus, our pillars are quality, service, and cost. And kind of in the strategic plan, our area of focus under that for quality is to reduce unwarranted variation and to standardize care. We also focus on providing equitable care to vulnerable populations, and in fact, we've signed on and we're in the process of implementing the AHA Equity Pledge. With respect to service, it's efficient, convenient, timely, and low-cost access, and to improve workforce engagement are our focuses there. And then on the cost side, it is really about we're really pivoting from what has primarily been an inpatient hospital-focused or a hospital-centric system. We have 4 hospitals in our service area, and we're really pivoting aggressively to the ambulatory space. So, we're working on a number of urgent care centers, implementing ambulatory surgery centers, and really trying to unbolt, if you will, a lot of the services that we provide currently on the hospital campus or adjacent to it. And we're moving out more geographically to where our patients are and trying to get closer to them in their home. We also need to optimize our capacity for smart growth, and then obviously sustainability as it relates to financial position is very important for us. We, in fact, this week we've been going through a small workforce reduction as a result of a lot of our cost management initiatives. It's a RIF of less than 100 people, but you never like to see people leaving your organization. Having said that, on top of all that, we also have a CEO transition in place. Our CEO, who's been in his role for probably about 23 years now and has over 30 years service overall, he announced his retirement a little over, I guess, earlier this year, and he's leaving December 31st of this year, so we have a national search currently in place, and obviously that's taken up a lot of my time, and it creates a lot of energy and curiosity within the organization as well. But overall, we're a good organization. We're a past Baldrige recipient. We do very well with respect to some of our quality initiatives, and Workday overall has helped us become much more efficient from an HR delivery standpoint.
Great. So it sounds like we've got some interesting perspectives and expertise on this panel. And at this point, I'd like to go ahead and jump into our discussion, and we can start with Mr. Fisher. Mr. Fisher, I'd love to get your perspective on what are some of the important factors healthcare leaders should take into account when selecting an ERP partner.
Yeah, thanks, Brian. I will try to be brief because I know everybody on the call wants to hear from our panelists, but I do think that there are 3 important factors when a healthcare leader and provider is selecting ERP technology. And the first one, I'll list all 3 of them, then I'll go through each individually. The first one is innovation. The second is a focus on business outcomes. And then the third is executive alignment and customer success. So when I talk about innovation, I of course mean you should look for and obviously partner with an ERP vendor that supports and is being cutting edge in areas like artificial intelligence and machine learning and blockchain. All of those technology buzzwords that we hear day in and day out. That's important. But I also think that there's an importance around industry-specific innovation. So whether that's supporting some of the things that John talked about around employee retainment, recruiting the best employees for his provider, or whether it is supporting robust, complex supply chain functionality like Bill mentioned at the beginning of the call, I think you should look for some of that innovation in your ERP vendor partner as well. The second one is a focus on business outcomes. Too often we're focused on driving costs down maybe of the purchase of the software, but really at the end of the day we should analyze and evaluate the software based on a business case and based on the value and the outcomes that we would receive from not only the software but all of the business processes that it enables, because implementation of technology for the sake of implementing technology is not going to help anyone move forward. It needs to be technology that is ultimately going to drive value and outcomes. And last but not least, executive alignment and customer success. The whole idea there is the sales process is very important. The selection process is very important to pick the right vendor. But then you need to make sure that that vendor is, number one, aligned with you as an executive or as a healthcare leader, and aligned with you to make sure that the implementation is going to be successful. And the simplest way that I can explain that is I've got a friend whose house I was at recently that uses a Nest thermostat. And bear with me on the example here. I'm going to be brief. They use this Nest thermostat, and it's a really nice brushed metal device on the wall that's digital and looks really clean, and it's very robust if you configure it the right way. It can adjust automatically to your temperature preferences or maybe the ambient temperature outside the house. But the way that he was using it was as a traditional thermostat. So you turn it to heat or cool, up or down, and maybe you only adjust it once or twice a year. So the whole reason that I give that example is the technology looks really cool and it looks brand new and it looks really shiny, but if you don't implement it and configure it the right way, you're not going to get the value out of it that you expect. And it's really important to have an executive alignment and focus on customer success beyond the actual sale and procurement of the ERP technology. So I think those are three important factors that we can keep in mind as we go through the panel discussion, and I'm sure you'll hear some of that come up as we go around the horn here. Thanks, Brian. It was a good question.
Thanks, Mr. Fisher. Thanks for framing this discussion for us. Mr. Mori, I'll pose a similar question to you, especially because, as you mentioned, you've recently been through an ERP selection. So what was your top priority for an ERP partner when going through this selection?
Yeah, thanks, Brian. And you'll hear me echo some of the same concepts as when. And I think there are a multitude of different factors to consider when you're selecting an ERP partner. For purpose of our conversation today, I'll break it down into two buckets. It's immediate considerations and then future considerations. So the fact of the matter is an ERP can have all the bells and whistles you can imagine. However, if your business operations are not ready to utilize and implement them, you have to look at the immediate needs. For me, a couple of things for immediate needs. It's really current state functionality. And what I mean by that is you want to make sure that the system can do at minimum what your systems are doing today and you're not losing any automation. But then also you want to look at that ERP current state functionality and identify what are some advanced things you can do with it and related to, I'll call it reporting, different business controls, basic usability and making sure there's a pickup there. And then what things do you have integrated today that you need integrated tomorrow to make sure you can implement it effectively. And then the second thing, immediate need, I'll call implementation ability. You need to make sure you select a partner that can support you not only through the cutover of the system, but as you transform some of the business, because it's not as simple as flipping a light switch. You need to transform some of your business to make sure you're extracting value out of that ERP. So you really want to make sure your functionality can advance, even if it can't advance leaps and bounds. You need to make sure you're not losing anything that you have currently, but then also you can implement successfully. But then the second part for consideration for Advocate Aurora was future state, and this is where it's really the exciting part, right? It's even if your organization is not fully ready to implement all the bells and whistles, you still need to ensure the partner has them, and you have the ability to extract value from them. So our supply chain was focused on a few things that fell into that, the future state bucket, really around enhanced functionality and innovation, really who is Workday partnering with in the market today to not only meet your needs, but look at advanced functionality for the future around automation, AI, et cetera. And they really checked the box there for us. Also, what strategic investments is your vendor partner making, both today and in the future? It's one thing to be the best of brand or best in breed today, but where are they going to go? So really understanding their strategic investment portfolio today and what they're going for in the future was really critical to us to ensure that, hey, we're getting into bed with someone who can really enable us for years in the future. And then really making sure that partner can adapt with business and market changes and innovate with business and market changes. We all know what's great today is not what's great tomorrow. So we need to make sure that partner has the capabilities to advance and innovate into the future. And really, looking at what Win had said around customer success, I think all those things fall under the umbrella of making sure your customer is successful. And candidly, for Advocate Aurora, particularly for supply chain, Workday was a calculated risk for us. They haven't been in the supply chain space for as long as some of the other competitors. But much to my surprise, as we went through demos and reviewed and went through RFP responses, the functionality is on par, at minimum, with all those other providers in the industry. But our perception, our supply chain team's perception was that Workday is running where others might be walking at a brisk pace. So that's really why we went with them at that calculated risk to say, hey, we think they're going to be the industry leader in healthcare ERP for the future, for years to come. So that was the big consideration and one of the exciting parts of partnering with Workday. So again, really excited to be partnering with them, but you really need to think through as you select your vendor partner, both immediate and future needs in that order.
Great. Thank you, Mr. Moyer. Some helpful comments there about getting the most out of your ERP. So Mr. Patz, you're live with an HR, financials, and supply chain application. ERP implementations are always challenging. So what did you look for in an ERP partner to make sure you were going to be successful with your implementation?
It's a good question, and we, having just taken supply chain live on June 1st, these are all near and dear to me of very recently. And, I think what I would start with is honesty. Similar to Bill, we took a calculated risk with supply chain. And, we made this decision a couple of years ago to bring this forward. And as we knew we were going to evaluate it, we knew that we were going to need to be careful and thoughtful about implementation. And so when the teams got together, the person who raised their hand first and said, I think supply chain would be ready to go live on said date was actually Workday. And so it was for them to stand up and say, here's when we think you'll be most successful. You could go live here. Here's the pros and cons. You could go live here. And we knew we would have some risk, but that brings me to the second piece, and that was one of the things that attracted me to Workday just in general, but really around this implementation, and that was the way they solve problems. And I thought that healthcare could learn a lot from that. We're fortunate enough to be about 20 minutes up the freeway from the headquarters. And so we thought bringing that kind of critical thinking to healthcare could be helpful, particularly in the non-clinical space. And so when we knew we had open items to go fix, Workday had the ability to go out and sort of look both in healthcare and outside of healthcare to bring clients and resources, both internal and others, for us to think about how could we make our implementation more successful. And then lastly, I would just say that expertise to do that. And you had a partner who's been engaged all along the way. It wasn't make the sale and kind of disappear. It was, okay, here's how we can do it. Here's experts within the country that we can bring to help you with the decisions you're making. We had taken HR live very early in the process, I think 2012, 2013. And so we had made some decisions then, not knowing we were going to go live with financials, that we had to go back and rework. And so really the dedication to come and help us solve the challenges that we would have had prior to going live, that commitment of just really staying engaged. And even now to this day, thinking about, okay, as Workday continues to evolve and advance and really build for the future, what are the right things for us both today, what's missing going forward, and then going from there.
Great. Thank you, Mr. Pass. You hear a lot more about healthcare, what healthcare can learn from other industries. So it's interesting that you took a similar approach to ERP selection. Mr. Hayden, at times we hear about a talent war in healthcare. The demands providers put on their healthcare employers are constantly changing. So during your selection, how did you measure what tend to be intangible requirements for an ERP system of the future, such as partnership and innovation?
Well, we really, to your point, and I'm sure the other folks on the panel and our listeners are dealing with the record employment levels, which really puts a lot of pressure on talent and the acquisition and actually the retention. So we spent a lot of time with respect to the process we went through. As was mentioned earlier, what's the here and now that are our immediate needs, but then going forward, what was the vision of the folks that we wanted to partner with in terms of how they saw healthcare, and in particular, some of the key areas from my perspective, which was the human resource aspects. And when we did our evaluation of the three vendors, when we looked at our overall evaluation, talent acquisition, reporting and analytics, and succession planning, we had we had about 10 different things we're looking at. We weighted them differently, and those three were 1, 2, and 3 in terms of the highest weighted. That's how focused we were and are on talent acquisition and moving forward. And really, some of the things we're able to do that they were able to work with us on and continue to do is, how do we make this experience for the users, particularly our employers and those people trying to get into our organization by way of applying for jobs, how do we make it as frictionless as possible? So we're at a point now we're just ready to stand up as people apply for various positions externally. They have the ability to self-schedule their interviews, and we do set up the interviews. We actually do them video right now before we take people further along into the process. And then when we look internal to our employees, we have a lot of, we're a fairly large health system, so we have a lot of internal churn in the sense of people moving throughout the organization, going from one place to the other. So we're able to track, as employees set up in their particular Workday module as it relates to employment and recruitment, we can track the type of positions that they've applied for, and we kind of map those. And now we're in a position to be able to, when we have a position that we're posting, whether it's internal or external, that matches to employees who have shown an interest with previous internal applications, we're able to push out an alert to them now through whether it's through email or through their phone, just to tell them that this position is available in the event that they're interested in applying for it. And again, that just goes back to how do we make this as frictionless and as user-friendly as possible. And then the other part I mentioned was the reporting and the analytics. We're just scratching the surface on that. And in fact, most recently, the group that we have really focused on this, we refer to them as our Human Resource Information Services area, or HRIS. And I just talked to our leader in that area recently and said something to the effect that maybe we should call them the People Analytics Team. How do we really start to use that information that we have to better predict what we're doing? So we're thinking of, for example, since registered nurses are our largest part of our workforce in terms of the job classification, we're starting to track more purposefully the people we hire and what school of nursing they come from. And then we're tracking how long they stay with us. And what we're really trying to do is just to get better analytics and predictability about the people we hire from certain schools of nursing, how long they may or may not stay with us based on some of the past information. So we're excited about that part, but as I said, we're still doing some of the blocking and tackling to make sure we're meeting the needs internally and externally, and then I'm really, really excited about what Workday can do and help us with the future analytics piece in particular.
Thank you, Mr. Hayden. And Mr. Fisher, I think it'd be helpful to bring your perspective back in here. Can you talk to us about what makes the ERP selections that Mr. Moyer, Pass, and Hayden went through different and correct? So in your perspective, what did they do differently to make sure they were selecting the right vendor partner?
Yeah, that's a good question, Brian. So first of all three are obviously very strategic healthcare leaders and work for very strategic organizations. And I think that has something to say with the success of their implementation, right? It's going into the selection, it's having a point of view. And that point of view may be, where do I want to take my operations? Where do I need to take my operations? How do I want to execute this selection? And then what are some of the criteria that are important to me, as we've talked about previously, in a vendor partner? So having that defined and potentially quantitative. We heard in the discussion that there are weighted factors and different scoring methods for evaluating vendors, some of those quantitative metrics. And then the second thing that I'll mention that I think they've done differently that's more on the qualitative side is the ERP technology of the future is a different delivery model. So it's no longer, I think John was the one that mentioned it, laborious upgrades every so often of the legacy on-premise technology. It's now a continuous delivery model in the cloud, and what that means for a selection is, and I literally think Bill, Chris, and John mentioned it, each one of them, is it's very important to make sure that right now the vendor can support your needs, but it's also very important to understand the innovation curve and the pace of innovation of that vendor partner. Where are they going to go with you in the future, and are they going to support your future point of view as an ERP partner? So I think those two tie very closely together. Each gentleman on the panel mentioned it, and I think it's what helped drive some of the success in their ERP selections.
Thanks for putting that together for us, Mr. Fisher. And Mr. Moyer, since you just went through an ERP selection, I want to ask you a question about immediate next steps after the selection of an ERP vendor partner. So what were some of the first steps you took with them to make sure your project got started on the right foot?
Yeah, thanks, Brian. So I think first and foremost, transparency is key with your vendor partner, and it goes both ways. So all too often, supply chains and ERP providers approach next steps and conversations looking to be braggadocious, talk about how fantastic they are. And not to say that AAH or Workday didn't have some of those conversations, but the meaningful conversations start with the problems you have and the opportunities you want to solve as both an ERP provider and a patient care provider like Advocate Aurora. So more specifically, our AAH supply chain has gone to great lengths to identify what transformation we have to go through to be both a value driver for our organization, but also to be successful for an ERP cutover like Wynn mentioned. So what this started for us is it started with our development of our supply chain operations playbook, which is a living and breathing document I made mention of before, of how we should be running our business from sourcing to operations to purchasing all the way through master data management, analytics, distribution. And this is what we shared with Workday to be transparent so they understood here are our plans for the future. And we challenged them to challenge us to weigh in on where does Advocate Aurora need to course correct? Or on the flip side, where can Advocate Aurora collaborate with Workday and their larger community to enhance the Workday tool, which they were extremely receptive on. And I'll say Workday essentially did the same with us, making a plethora of their teams available to discuss past, current, future state roadmaps around development, standard functionality, and implementation. Equally, Workday challenged Advocate Aurora to poke holes in their tools and methodologies. So that's really been our first step, is seek to understand first. It's been a very lengthy exercise, which we're still in the midst of. However, it's been meaningful to ensure both Workday and Advocate Aurora push the boundaries of what everyone keeps on deeming best practice, but also to enhance that best practice and really enhance our operations and enhance our technology respectively. So that's what I would say is really that transparency to really plan and understand is the first step, and collaborate to get those things on the books to understand what those tools can do so you can then roadmap your future.
Great. Some helpful information there, Mr. Moyer. And I've got a follow-up for you, it's a little more forward-looking. So where do you see the future of ERP going? What excites you about the trajectory of the technology?
Yeah, Brian, I'll unbox that question a little further and address a widespread issue I see with healthcare organizations and the concept of implementing ERP. First and foremost, I believe many organizations enter into ERP implementation believing it'll solve all the world's problems, whether that's controls, reporting, basic operations, etc. However, our philosophy at Advocate Aurora within the supply chain team is that you can turn on a system tomorrow, but that doesn't make it drive value and enhance your controls for the organizations. What does drive value are the business transformations that occur within policy, process, procedure that you must complete before, preferably, or during the ERP implementation to make it meaningful. I believe until your organization can do the transformation component of ERP, that enhanced technology offerings are simply that. They're offerings. They're not meaningful. But to answer your question more directly, I believe there are a couple of things around the horizon in the next 2 to 3 years as it relates to ERP technology, and frankly has already begun. I think first is further integration with your EHR. You heard me talk a little bit earlier about one of our keys to success in the future is really going to be how do we integrate our ERP, and not just for simple inventory management. It's for a whole enhanced different things around functionality, reporting, etc. This is where we really see significant value being derived from. And I'll give 2 examples is by integrating those tools really to drive and look at enhanced cost per case analytics. It's one thing that your supply chain team can negotiate a lower rate. It's another thing that they can truly impact utilization. And so many organizations out there say they have cost per case data or have a third-party benchmarking tool. And the bottom line is when we've really taken a deep dive on some of those different third parties, we find that the data in is wrong. So that integration with ERP and an Epic or any other EHR is going to be critical to drive that. And then obviously supply reliability. When we think about integrating those 2 tools, now I can look at block scheduling, I can look at pref cart, I can look at on-hand inventory in those procedure-based areas like the OR and really forecast inventory effectively. So where we look at it is that should almost eliminate any issues we have with supply reliability in the next couple of years, which is going to be critical to provide enhanced care. But then also another thing where we think, at least I think where ERP is going is really more and more machine learning. On the supply chain front for us, it means more automation, more advanced functionality, whether that be preference cards, automation, ROP, EOQ automation, lead time automation. These are all things we've touched base with Workday on and talked to them about what they see as the vision in the future and things they've already been working on even pre-Advocate Aurora discussion. So really excited for that. And beyond that, honestly, Brian, there's daily advancements with things with blockchain, API, artificial intelligence that I'm sure someone much more intelligent than I will find great uses for.
Thank you, Mr. Moyer. Mr. Path, I'm gonna throw a similar question your way. So how are you continuing to collaborate with your ERP vendor partner to drive innovation in your organization? And what excites you about the future of ERP innovation?
So we, as I said, we've taken the majority of what I will refer to as the big ERP functionality live, and we're using it and we're happy with it. And all of those have gone through a similar migration that I would say is it was designed and built somewhat for the internal team who works on it regularly. Then it sort of gets spread out to the broader group of individuals maybe in that home department. So think the accountants working the close, the rest of the finance team explaining the close, and then lastly out to the broader organization to be able to absorb real time and self-service and better manage their business from a financial or supply chain or the different perspectives that Bill mentioned. And, I think what we look at are what are the next things that we can put in and automate the business, both with the new functionality that might come out, or, and just as important, when we did our implementation, we made sure to take almost all of the team were operational experts, and they've all been returned, if you will, to their home departments. So they can actually think about the work they're doing on a daily basis and leveraging Workday functionality to either automate it or use the system to do the work versus them. And for us, we really have a push to do that so we can focus on what's really important, and that's taking care of patients and our customers. And then from a future perspective, I think one of the advantages that Workday brings, and I know they have a lot of, the buzzwords of AI and machine learning, I mean, they're doing that in that tool. We spend a ton of energy in healthcare thinking about AI and machine learning on making people well or taking care of them differently or healing them faster, which is where we should be focusing the time. but that leaves very little resource to go do it in other areas that can actually improve the cost of healthcare and other things. And so what I'm most excited about, or one of the things I'm very excited about, is as Workday does that, we can take advantage of being a customer to be able to implement some of those tools that industries like banking and others will take the time to invest in it internally because it's their core business. ERP isn't our core business, so we're looking for partners to drive a lot of that innovation and investment.
Thank you, Mr. Pass. And last but definitely not least, Mr. Hayden, I have a similar question for you. So any final thoughts on the future of ERP, especially around the employee experience and continuing to keep your employees engaged?
Yeah, that's a great question in terms of the engagement piece in particular. We, like other organizations, have 4 different generations in the workforce, and engaging them electronically is a challenge because we all learn in different ways. As I mentioned earlier, we're trying to create as a best experience as we can for our customers. I used a couple examples before. Internally, a bugaboo of mine for years has been the annual performance evaluation, and I have been determined, although not very successful at this point, to try to end the annual performance evaluation as we currently know it in healthcare. And I think the ERP and Workday in particular can help us with that. So we're really trying to figure out a way. And there's some organizations out there, Deloitte being one of them. There's a couple others that have been able to, through their tablets, cell phones, whatever the case may be, is to create an interface with Workday Performance Management and able to provide real-time recording of coaching and providing feedback. So if something happens and I'm working with one of the folks that reports to me, and whether it's feedback for to try to improve, or coaching in terms of moving them somewhere, that I can immediately make a note for myself electronically. It would move right into that person's file, so to speak. And so whether it's 90 days, 180 days, or at the end of the year, I can pull up that information. We can sit down and have a conversation, and none of it should be a surprise to the employee because, of course, they would have had a copy of the information that I provided to them as well. So we think we just have to really think through how we want to do that. But to me, that if I could finish my career having some impact on the proverbial annual performance evaluation and make it more real time, try to help our leaders become better at coaching as opposed to episodically talking about people's work and the things that they're doing, that would be a contribution that I think I would love to leave my healthcare colleagues in the healthcare industry, in human resources in particular.
Great. Thank you, Mr. Hayden. And Mr. Fisher, I'll throw it back to you. Do you have any final thoughts before we dive into some audience questions?
Yeah, thanks, Brian. No, I think we've had a lot of great commentary from the panel, and it's obvious that it's an exciting time across the healthcare landscape, whether that's redesigning supply models, better understanding the financial performance of our organizations, or keeping our employees engaged. There's a lot of change, and it's a little bit scary, but it's also very exciting. And I think you heard it here in summary: have a point of view, be open and collaborative with your ERP vendor partner, but also hold them to a very high level of accountability to help you move your healthcare operations into the future. I think that's really it from me, and we can go ahead and open it up for some questions.
Great. Thank you, Mr. Hayden, Moyer, Pass, and Fisher for that great discussion. We'll now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the Q&A box on your screen, and we'll try to get through as many questions as we can. The first question here is addressed to all of the panelists. So the attendee is wondering, how long did your ERP selection take? Bill, do you want to kick us off?
Yeah, happy to, Brian. So we did it in pretty short order, and I think there's another question around why we selected an ERP system. But it took about, from start to finish, 6 months. There's key stakeholders, specifically IT, HR, supply chain, and finance, we're all key stakeholders in making that selection. I think by the time the contract got signed, it was a little bit longer, but the selection process was around 6 months after we put out the RFP, had people come in, do the demos, and did all the effective quantitative scoring and qualitative reviews. So about 6 months.
Great. Chris, you want to weigh in?
Yes. So a little bit different for us. When we picked HR way back when initially, I wasn't involved with that actual selection, but I think that took a couple of years because they were really trying to determine what, in fact, we needed in a system. So take that aside. We started the process sort of for our, what I'll say, modern ERP was a 9-month process, and that started with picking a partner to help us with the evaluation, setting up the criteria, then evaluating, and then because we had Workday in place, we did a little bit of a different look on this to give other competitors a fair shake. So we did one selection process was more of a why not Workday, and then the other one was a broad, sort of a broader selection process. And when all was said and done, Workday was chosen whether we would have had it in place or not. And the financial analysis and business case did weigh into that, although both solutions would have been savings for us. But 9 months was the total.
Great. John, you wanna take the next one? Let's go ahead and weigh in.
Sure. We, as part of our human resource strategic planning process in late 2016, we decided that we needed to move away from PeopleSoft for some of the reasons I indicated earlier. So we actually spent roughly the first 6 months of 2016 doing the RFP process. And we also made a decision, and this is not a advertisement or endorsement per se, but we decided to have an implementation partner. We didn't have the expertise within our IT or HR areas to really look at, particularly if we were going the cloud route. So we partnered with Deloitte, and they were our implementation partner. So those were kind of the key decisions we made. To go through an RFP process, we selected Deloitte as our implementation partner, and then we actually made a selection, selected Workday, I think it was in June of 16. And then our go live date was June 25th of 2017. So we took about 11 months to a year for actual implementation. And one reason we did that is we literally put workshop process mapping teams together, and we went through every HR process, whether it was separation process, leaves, benefits, compensation, you name it, everything we do. We sat and we went through a process of here's how we do it, but how should we be doing it? And using Workday, obviously, the structure that Workday provides us to help with respect to that. And spending that extra time and money, quite frankly, to go through and basically redo all of the human resource processes over the course of that time and tailor them then to the capability of Workday really helped us meet our go-live date of June 25th and really overall a very successful go-live with very, very few hiccups after the fact. So it's a little different, perhaps a little longer than some of the other folks, but that worked for us.
Great. Thank you, gentlemen. Appreciate the various perspectives there. And so our next question here is, again, addressed to all the panelists. And this attendee asked, what event or series of events drove you to determine you needed to evaluate your legacy ERP system? And John, I'm wondering if you can talk a bit more about that.
Yeah, I think, as I said, we were using PeopleSoft. We weren't using all of the modules that we were paying for at the time. When I came here, it had already been in place for probably 5 years. So we were in like the 18-year mark of PeopleSoft. And we found that we had a lot of workarounds to try to make different things kind of work, particularly on benefit plan design. And as I mentioned earlier, it seemed like every 12 to 18 months we were doing an upgrade on a new release, and it was labor intensive. I mean, between the IT staff and our internal HR staff, it was almost like a mini implementation of an IT platform. And and it didn't have the capabilities to do some of the things that we knew we needed to do going forward to provide more of the the real-time experience for our employees and for our external applicants. So that was, I think those were the big drivers: just the resource, the added cost, the attention that it drew away from other HR initiatives that we were working on every time we had to move to a new release. So it literally, and then as it were, I think from a technological standpoint, it seems like an organization should be reviewing more than every 15 years whether something's working for you or not.
Great. Thank you. That's helpful to understand. And Chris, same question to you.
Well, first, I just have to be happy that I get to go ahead of Bill because he always has such great answers. So thanks for your order on this one. The kind of a lot of little events that made this a big issue. So our audits, financial external audits, they were becoming increasingly more difficult to come up with a clean audit because of so much manual work. One example, 17 link spreadsheets in order to create our financial statements. We were on very, very old technology, healthcare specific. McKesson Star was our GL. We had gone wall-to-wall Epic, and when McKesson spun out some of their hardware, I think it was Change at the time, or they had spun it out. There was rumors going around, they weren't going to support it. So you had that. Just the general legacy technology that we were deploying and really saying, look, we need to modernize this. We actually had tried to take the business case for an ERP forward twice, and it did not get voted forward both times as with my predecessor. And so all those components of really needing the modern system and being able to upgrade and get the integration that everybody was celebrating with Epic, I think all of those really drove us to, okay, we need to put a business case together and make this thing work and commit to making the operational changes to be able to pay for it. And that's actually occurred for us. And so I do think it's opened our eyes to think about how can we use technology to replace some of our legacy systems and costs.
Great, thank you. And we are at time here, but Bill, I want to give you a chance to weigh in. So same question to you.
Yeah, thanks, Brian. So again, I think Advocate Aurora's journey is a little bit different just because of our circumstances. So with the merger, we have a plethora of different systems in HR, finance, supply chain, some homegrown, some out-of-the-box solutions. So as Advocate Aurora continues to look to grow within the industry, one of our objectives is to standardize a lot of our systems. You heard me make mention of Epic. That's going first, and then standardizing our ERP. So that was one of the top priorities from our HIT team, who are fantastic, to make that selection so we can implement that pretty quickly here. So that was really the objective and the trigger for why we had to select and move forward so quickly. So, yeah, that's pretty much it.
Great. So that's all the time we have for today, and I want to thank our panelists for that excellent discussion and Workday for sponsoring today's webinar. Everyone enjoy the rest of your day, and we look forward to having you join us for future webinars.